guys. So today I'll be telling you about my fertility protocol, and it will generally work for majority of the population. Of course, there are other factors, and it's an individual case. But generally, the fertility protocol that I recommend anyone is like as follows. Now, again, before I get into this, do not take this like practically do this yourself without any medical supervision. Go to a physician. He or she will recommend you a better fertility protocol. However, this is again an option. Like, you can discuss it with a physician if you are having trouble conceiving a child. Okay, so let's get started. Now, this is mainly focused on like males who use steroids. Of course, I will tell about what a female can do. Again, do not take this seriously. Talk to a physician. Okay, so let's get started. For males, when we come off, we generally do a PCT, post cycle therapy. Now, the purpose of PCT is kickstarting the testosterone production before the drugs in the system go out and we start losing muscle. So by the time the drugs leave, the HCG, the natural production has already started. So we use considerably small amount of muscle as we would have if we hadn't used HCG or any PCT substance. Now, to regain fertility, generally it's HCG 2000 IU every other day. Now, what HCG does, it's give a kick to the pituitary gland to start producing the natural testosterone production. Now, when you inject HCG, it gives signal to the pituitary gland to start the production. The pituitary gland then start the testosterone production. Okay. After and then further, I'm not going using medical terms. I'm just simplifying what it does. Now, after HCG, it indicates the testicles to produce sperm. Now, Now, it generally works for most of the population. However, sometimes the testicle do not produce a sperm. Now, testosterone production is on, testosterone is normal, but sperm production is not there. Now, in this case, we use HMG. HCG is the first step. That doesn't work. We use HMG along with HCG. Now, HMG, what it does, it cuts the middleman. It directly sends signal to the testicle to start producing sperm. Now, the general dose of HMG is 75 IUs. Now, what most people do not take HMG into consideration is, well, mainly because HCG is we are using it for bodybuilding purposes to preserve muscle. HMG is for fertility only. Okay, HCG 2000 IU every other day, 75 IUs of HMG every other day. So Monday HCG, Tuesday HMG, Wednesday HCG, Thursday HMG for a month. Get your lab result back, your testosterone tests, your fertility tests, sperm mobility. It should bounce back to normal. If it doesn't, then you can then take a 15 days break. Again, start this protocol at a high dose. Do not increase the HMG. You can increase the HCG to 5000 IU. You can add proviron at a low dose. Now, proviron at high doses will suppress, but at low dose it increases free testosterone. You can use AIs or SERM, Clomid. Generally is a better option for fertility purposes. So it's a case by case study, but generally 2000 IU of HCG and 75 IUs of HMG every other day will work for most of the population. For females, Clomid and HCG is recommended. However, do not use it yourself without any medical supervision. For females, Clomid is recommended. Now what Clomid does, it releases like eggs, which further helps for in fertilization of that egg. Now what personally, what's wrong with Clomid? Okay, you can control how many eggs the drug will release. It can be one, it can be two, it can be four. Now let's say four eggs has been released. Okay, all four of them are fertilized. Now chances of birth defects of those eggs are very high, and the risk factor to the mother survival rate will decrease. So that's the protocol for females, Clomid, and a low dose of HCG. Generally, it's 200 IUs every other day for like 3-4 months. Again, it's an individual by individual case. Do not use this like it's just a guideline. You can discuss it with your physician. However, do not use it yourself. High doses, overdosing these stuff will further suppress your sperm and testosterone production. Now, the last option is triptorelin. Now, triptorelin is only one shot. However, low doses of that same compound is way more effective than a single shot of high dose. Now, problem with that triptorelin is you can use only one shot for 6 months, and if you use over and accidentally overdoses, it will have castration like effect. So that's how much suppressive that drug is. Okay, however, this HCG HMG protocol will work for most of the population. So that's pretty much it for today. Thank you, and please like, subscribe and share.